you may not be able to obtain trained medical aid in time. There are many forms of disaster. They can happen to you and your family at any moment. This film is one of a series on medical self-help. Its purpose is to teach you what to do in an emergency situation when there is no doctor.
Within the human body, as we work, sleep, and play, an invisible life stream, a precious red fluid that sustains our health. But let's look more closely at this fluid and the way it circulates throughout the body. Area of the body, smaller arteries. Blood returns to the heart of vessels called veins. As a complex system, our veins lead to the great veins that go directly to the heart. There is also another network, innumerable tiny, narrow, thin-walled vessels called capillaries, connecting the arteries through arterioles, to venules, to the veins. In sum, this is a complete network of vessels carrying oxygen and food to every part of the body, also fighting disease germs and helping to get rid of body wastes. To perform this work, the average-sized adult has about 6 quarts of blood in his body. A child, about half that amount. Were an adult to lose in a short period of time 1 quart of blood, a child 1 pint, life would be endangered. Fortunately, however, when we are injured, our blood has a unique characteristic, the ability to clot when bleeding occurs. This clotting process, aided by certain substances in our blood, coagulates or thickens the blood when it is exposed to air, and in a short time forms a plug that reduces further bleeding. Application of direct pressure over the wound helps to speed the clotting process. When only a vein is damaged, the blood flows somewhat slowly from a wound and, in most cases, can be controlled with relative ease. However, blood from an artery emerges from a wound in spurts and, if not quickly controlled, will soon result in shock. This is your cue to arterial bleeding, bright red blood gushing from a wound. In this case, a clean handkerchief will be used as a dressing. Applied over the wound along with direct pressure. In this emergency, with no first aid materials on hand, you decide to use your belt as a bandage to hold the dressing in place, as well as to maintain pressure. Blood from an arterial wound, however, soaks through the dressing. And additional dressing must be improvised. While care is taken to maintain direct pressure over the wound. Again, the dressings, absorbing the blood, will help coagulate or thicken it, and thus slow up bleeding. But what do you do in the most austere situation, when even the barest essentials for care of an arterial wound are unavailable? This flow of blood must be stemmed. If you can't find a clean cloth, there is a ready alternative. Use your bare hand. Remember, The important thing is to stop the bleeding as quickly as possible. Another accident situation where direct pressure and use of a dressing have failed to stop severe arterial bleeding of an arm wound. Here, another measure is called for. Pressure on the main blood vessel supplying this part of the body. In the arm, the brachial artery. In the leg, the femoral artery. By pressing the appropriate blood vessel against the underlying bone, you can lessen severe bleeding of an arm or leg wound. You'll find the brachial artery on the inner half of the arm, midway between the elbow and armpit. To locate the vessel, feel for its pulsation. Then apply pressure quickly and firmly. You can locate the pulse beat of the femoral artery on the front inner half of the thigh, where it joins the body. To help control bleeding, apply pressure with your fingers or the heel of your hand, compressing the artery against the underlying thigh bone. In this situation, direct pressure methods have failed to halt gushing of blood from a leg wound. You know that continued loss of blood may prove fatal to the victim. With the life ebbing away, then, and only then, is the time to employ a measure that is a last resort. Use of a tourniquet that may mean saving a life, but also later amputation of the limb, since its lack of blood supply may cause death of the tissue. However, saving a life is your choice over possible loss of a limb. To apply a tourniquet, use your belt, necktie, stocking, or a bandage. In fact, any flat material about 2 inches wide. Don't, however, use a wire, rope, cord, or any material that may injure underlying tissues and blood vessels. Place the tourniquet between the wound and the heart, also as low as possible above the wound. However, in the case of bleeding below the knee or below the elbow, the tourniquet should be placed above the joint. To protect the skin, put the tourniquet over a trouser leg, shirt sleeve, or other material. After making a loop around the limb, tie the ends together. With a strong stick inserted under the loop, begin tightening it, but only enough to stop the arterial bleeding. Remember, if the tourniquet is too loose, it will shut off only the venous return vessel, which will increase the bleeding of the wound. Secure the tourniquet in place by tying one end of the stick to the limb. That will keep it from slipping off. The wounded limb is extremely subject to cold injury, so try to provide it with some protection from the weather. Finally, bear in mind, a tourniquet is a measure only of last resort, to be applied when all direct pressure methods have failed, when with no other way of stopping blood gushing from a wound, life itself is at stake. Most external bleeding, however, can be controlled by application of direct pressure. Once the bleeding has stopped, a bandage should be used to hold the dressing in place. One not necessarily sterile, but as clean as possible. In this case, a roller bandage, one of 3 basic types of bandages, will be used to secure the dressing. Note how this type of bandage is applied, with the loose end held at the bottom as the roll is passed around the injured part. It is applied evenly and firmly, but not so tightly as to cut off the blood supply. The bandage should be anchored in place by splitting it to a length that will provide 2 ends, which are tied to prevent the bandage from tearing further. The ends are then wrapped in opposite directions around the limb and knotted with a square knot. Always check a bandage after a half hour or so to see that it hasn't reduced circulation. Note that in a leg wound, the toes should be left exposed. If they become blue or swollen, it means the bandage is too tight. So far, we've covered treatment for severe arterial bleeding, indicated by the gushing of bright red blood from a wound. But what about care for venous bleeding? Use the same principle of firm, direct pressure on the wound as you would in arterial bleeding, and continue this pressure from 5 to 10 minutes up to a half hour if necessary. Work carefully, taking your time. Remember, your own behavior will be reflected in the victim's reaction to your treatment. Bleeding has now slowed to a point where a bandage is required to secure the dressing. You can improvise a triangular bandage from muslin, sheeting, a blanket, or any other strong material. It is probably the most versatile of all bandages, for it can be folded in a variety of ways to fit almost any part of the body. Another use of the triangular bandage, forming it into a sling to support the injured limb. Note that the fingers are left exposed, so that if they become blue or swollen, over-tightness of the bandage will be indicated. Here, in another type of disaster situation, we come to a different kind of bleeding wound. When a limb is injured by a crushing force, there is surprisingly little bleeding. Since the damaged edges are closed by pressure from the surrounding tissue. First, treat the victim for shock. Then, after applying a sterile or clean dressing to the wound, you'll need a bandage to secure it in place. Here, a four-tail bandage is prepared by splitting any type of clean material from each end. Such injuries often cause swelling, and the four-tail bandage is quick and easy to adjust. Another type of bleeding wound. Coughing up of bright red frothy blood that may contain air, pointing to a possible chest injury, especially in the presence of painful breathing and shock symptoms. Because part of the hemorrhage is beyond reach, direct pressure to control bleeding is not practical. But there are measures that can be taken to prevent air from being sucked in and blown out of the chest cavity through the wound. Note that as the injury allows incoming air into the chest cavity, the lung is compressed and collapses, making proper breathing impossible. In fact, you can hear air being sucked in and out, and you may also see bubbling of the blood from the wound. You must act quickly to make the chest wound airtight as soon as possible. As the victim exhales, apply a dressing large enough to stop the flow of air through the wound. With the dressing packed firmly over the wound, cover it, if possible, with a large piece of material, and bind this covering securely over the dressing. Have the victim lie on his injured side to permit the uninjured side to receive more air. If wishes, however, let him sit up to ease his breathing, even though he may be in shock. Keep his head higher than his chest. In a disaster, there may be many kinds of bleeding wounds, ranging from minor cuts to severe abdominal, chest, and head wounds. For example, it may be an abrasion, easily infected because of the wide surface of tissue exposed. It may be an incision, a clean-cut wound that bleeds easily and is not so likely to become infected. Or a laceration, tearing away the skin and tissue, extremely susceptible to infection. Or a puncture wound, usually bleeding very little, but also highly susceptible to infection. General care of these and other types of wounds, after verifying that there is no severe hemorrhage requiring immediate action, includes stopping the bleeding and making sure the airways are clear. Treat for shock until the victim can be moved to a sheltered area. Once in the shelter, expose all injured areas. Remove clothing from a wound by tearing it away rather than pulling it over the wound. This lessens danger of infection. When, as in this case, the wound is minor, wash it with soap and water. Start from the edges and wash away from the wound in a circular motion. Then apply a sterile dressing and bandage, for no matter how small the injury, unless properly protected, germs may enter the wound and cause infection. On the other hand, if a wound with a small amount of bleeding cannot be bandaged properly, better leave it exposed rather than use a dirty dressing or bandage. The blood will shortly coagulate and form a protective seal over the wound. Now, the care of other wounds of the body which are in themselves serious or may point to complications even more serious than the surface wound. First, treatment for bleeding from the ear. An ear bleeding associated with an injury can mean a fractured skull. Do not wash the ear because infection might be introduced into the brain. Simply apply 2 or 3 pads of gauze over the outside of the ear, taping them into place to prevent anything from entering the ear that might develop an infection. To a skull fracture, usually associated with an injury to the brain, a head wound may, as in this case, be merely a cut or bruised scalp. However, before applying a dressing to a scalp wound, always check the area of the wound to see if there is any indentation or cupping of the skull. To stop the flow of blood when there is no sign of a skull fracture, apply direct pressure gently to the wound, with the victim lying flat on his back. Once a dressing is applied, don't remove it for at least 1 week unless there are definite signs of infection. In that event, it will be necessary to change dressings daily. When there is no sign of infection, remove the dressing at the end of 1 week and clean the wound with soap and water before applying a new dressing. However, in this situation, the victim's head wounds have been dressed, pressure applied, yet bleeding has not been completely stopped. Place him in a sitting position for a short period until the decreased flow of blood can coagulate and stop the bleeding entirely. Stay close to the victim. Watch him carefully. He may be weak and dizzy. And provide support so he will not fall over and injure himself further. How can you tell if a scalp wound is associated with a skull fracture or brain injury? By one or more of these symptoms. Is she or has she recently been unconscious? Is other fluid escaping from her nose and ears? her pulse slow? Has she a headache or convulsions? Are the pupils of her eyes of different size? Has she difficulty in rousing, or is she vomiting? If the answer to any of these questions is yes, suspect a skull fracture and/or a brain injury. In such a situation, apply a soft, sterile dressing to the wound without, repeat, without any pressure, even though bleeding may continue. Bear in mind, in case of a depressed fragment of skull bone or exposure of any brain substance, it is extremely dangerous to apply any pressure to the wound area. Just cover it lightly. Merely bandage the dressing in place, with the bandage only snug enough to keep it from slipping off. As in treatment for all head injuries, have her lie flat, with her head level or slightly raised, and keep her warm. During the first 24 hours, give her nothing to drink. If her temperature rises, use sponge baths of water or alcohol to bring it down. And always be sure to keep the airways clear. She must be kept warm, and both her pulse and breathing will require continuous observation. Next, treatment for neck and jaw wounds. Because of the many blood vessels present, bleeding from wounds of the neck is usually severe. To stop the bleeding, exert direct pressure with a sterile or clean dressing. Then, bind the dressing in place to protect the wound. If a large artery or vein is cut, apply hand pressure above and below the cut, maintaining this pressure until the bleeding has slowed. Don't be afraid of contaminating the wound with your hands. If the blood makes the neck slippery to grasp, use a folded cloth or a pad of clean material under your fingers. A victim of a neck wound may choke because of bleeding inside his throat. So have him sit up with his head held forward and down. Or preferably, have him lie face down. In a jaw wound, there is also usually severe bleeding along with the danger of choking on one's own blood. Apply direct pressure to stop the bleeding. Again, have the victim sit up with his head held forward and down. Such an injury should also be treated as a fracture, as the dressing is secured to protect the wound and support the fracture. Tie the bandage over the top of the head. Secure the bandage with a large bow knot, leaving the ends easily available, so that in the event of need for vomiting, he can rapidly loosen the bandage. Finally, injuries that can cause internal bleeding. For example, chest and abdominal wounds. In such a situation, there is little you can do other than have the injured person lie still while you keep him warm. If he's unconscious or only partly conscious and also coughing up blood, turn his head to one side to prevent the blood from choking him. Wipe the blood out of his mouth and throat if he can't spit it out. In an abdominal wound, the greatest danger is from infection. Actually, there is little you can do without proper medication and medical supplies. Though there is very little external bleeding, be sure not to apply pressure to control the bleeding. Simper the wound with a sterile or clean dressing and fasten it securely in place. Then treat the victim for shock. In this film, you have seen various types of bleeding wounds, as well as measures to be taken to halt the loss of the life-giving fluid, on which so many vital functions of the human body depend. Now, let's recap some of the major points in care and treatment of bleeding wounds. You can almost always control bleeding by direct pressure on the wound. If no broken bones are involved, elevating an injured leg or arm will help lessen the loss of blood from a wound. Compressing the main supplying vessel against the underlying bone can help in quick temporary control of bleeding. A tourniquet should be used only when all other methods to stop the loss of blood have failed and when someone's life is at stake. Be sure to bandage dressings firmly in place using a roller, triangular, or four-tail type bandage, as called for by the location and kind of wound. In caring for a bleeding wound, act calmly and confidently. Your own assurance can do much to reassure the victim of the wound. Finally, after the bleeding has been controlled, see that the injured person is warm and comfortable. If necessary, treat for shocks. Remember, the human body can withstand only a certain loss of its precious life stream. In an emergency, with medical assistance unavailable, the skills you learn today may help you save a life tomorrow.